and welcome to Wellness Diaries on Top Joyful Talks TV. This is what we do every Sunday. We try to, touchlight all those health matters them so that young people go fit make better decision when it comes to their health. Today we are talking about menopause, the facts, the myths, everything that has to do with menopause. Yes, I don dey hear plenty, question. People don dey ask plenty question about this menopause. In fact, even young people don dey fear when they never even reach the age. They don dey fear. They don dey hear plenty things about hot flashes, how they dey do, you go enter mood swings and plenty things about menopause. So they don dey fear. It be like say they never, really understand this thing, and they are not well prepared. So now make me carry Dr. Adeogu come today on Top Wellness Diaries, make he demystify all these things, myths, and give us the facts and wetin young people suppose understand about menopause. Say if you never reach the age, don say and after I'm a young person, I never reach the age. E better say you know wetin, because na nature. Every woman will eventually get to that stage. So if you no know, you don't know how to manage am. By the time it comes, it becomes a big problem. So now make me carry Dr. Adeogu come today. If you never subscribe to my channels, kindly subscribe to my channel at Joyful Talks TV. Hit the notification button so that when we have topics like this, you will not be, you no go miss, you will not be left behind. You no go boss no go waka leave you behind. So now make me carry doctor come. Dr. Adeogu is a medical practitioner, a public health enthusiast with a decade, plenty years of experience. When you call decade like this, it be like now plenty, like 10, 15, 20, plenty years of experience. Now he carry come on Top Wellness Diaries today. So he don work for different places, private and public health institutions, and he know wetin we dey talk about today. Na the right person wey come on Top Wellness Diaries today. Dr. Adeogu, good evening. How are you doing?
Good evening. Fine, thank you.
Welcome on Top Wellness Diaries. Now,
Thank
make we
you.
no waste people time. Make we just go straight to the matter. Wetin be menopause? I wan make you, no be plenty English. Say una wey be doctor, una sabi speak plenty English. When people no go understand. So I wan make you break am down, pieces am, so that layman, person wey no even be doctor, go fit understand wetin menopause be and what age woman go begin experience am.
Menopause, like you said, it be a phase in a woman's life.
Okay.
Every woman must reach that part of their life. No be disease at all.
Good.
Na phase where everybody go pass through if them be woman.
Gam.
So if you are a female, e get age where your menses start. We dey call that one menarche, where your menses start. The first time where you see your period, na menarche. And then when the menses go end, where you no go see them again at all, that is menopause. So for a lot of women, it fall between the ages of 45 and 55. Now around that range, where many people they say they don't reach this menopause where they talk about. So for most people, on the average, gets to menopause around 51. But before you get to menopause, where you be say you no go see the period again at all, you go down dey see some small changes wey go dey happen with your period, with your menstrual cycle, small by small. So wetin we dey talk about menopause be say, apart from the fact say your period go stop around that time, before you get to that age where you no go see your period at all, you must reach 1 year where you no see your period before we say you don't reach menopause. If you still dey see your period in between, you never reach menopause. You are still in perimenopause. So perimenopause is that time interval between your normal reproductive cycle where you dey see your menses regularly and when the menopause proper go come. That is perimenopause. That is around menopause. But when you reach menopause, gone, everything go stop. You no go see the period again, and it go reach 12 months where you no see the period at all. Then you go now say this madam don't reach menopause full time. So no be say you go see am this month, you no go see am another month, you go come out another month. That one no be menopause. So that one can be hormonal problem,
Okay.
hormonal imbalance, and some other things. But menopause itself is must reach 12 months of not seeing your period at all. Then we say you don't reach menopause.
Menopause.
And this parts of a woman's life, they come with all sorts of issues, challenges, health problem, changes that we'll still talk about as the questions come.
Okay, you don't talk about wetin menopause be now. So now I don dey hear pre-menopause, post-menopause, middle menopause, plenty 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 grammar wey I no understand. So please help us break this thing down. Which one be pre-menopause and which one be post-menopause? And wetin be the challenges between this, these periods, either pre-menopause or post-menopause?
So perimenopause is when
You don say am
you
na
dey see your period
perimenopause.
normal. Perimenopause, you dey see your period normal as a young woman. You fit get belle around that time. So the period between when you dey see your period normally and when menopause happen gangan is
Like how, which
perimenopause.
age, what's the
Perimenopause
age range?
always
What's the age range for
it
this
it
perimenopause?
it is that perimenopause dey occur, for some people as from the age of 40, they can start noticing that things are changing in their menstrual cycle. And
Okay.
they just notice that in this perimenopause, maybe your period is not coming like it used to come, it's not coming out well,
Regular,
it's
like
becoming
somebody wey
scanty,
get
it's not
regular
regular,
period.
and they come out heavily like before, or the flow has changed. And then you now start noticing changes like there's so much irregularity with your period. You are noticing sometimes that you are tired. You are noticing sometimes that you may start having some sleep disturbances. A lot of people have concerns around this perimenopause, especially for women that still want to have children. So
Okay.
around that age, they are now concerned that this one, that their period is not coming regularly, or it will affect ovulation, it will affect their fertility. So they are worried about so many things around that perimenopause. So perimenopause is what comes before the menopause happens itself. So it is just around menopause, but menopause has not been achieved yet in perimenopause. So perimenopause happens to everybody too. It's a phase where before you get to the menopause, you're already noticing some changes that may be pointing to the fact that menopause don't dey knock on your door.
Okay.
Menopause don't dey approach. Yes.
So
So
the post.
menopause itself is when the period stops for 12 months. You are not seeing it at all. It has gone away completely. That's menopause itself. And we'll still talk about all the things that come with menopause. Then the post-menopause is you have reached menopause. You have 1 year has passed and you have not seen your period at all. That period after that 1 year completion is post-menopause. So other things can now start happening in post-menopause. So when you have reached menopause, a woman is not supposed to see blood again. So if she starts seeing blood in post-menopausal period, we are concerned about cervical cancer. So any woman wey don reach menopause, e come see blood after menopause don pass 1 year wey you no see anything, suddenly something come appear, make dem run to the hospital,
So no be
because it's
miracle.
not a good thing. No, e no be miracle, no be miracle baby, dey come, na problem. So you run to the hospital and get investigated. And that is why even before you reach that part, we dey tell all our women cervical pap smear. They go for cervical pap smear to screen against cervical cancer, so that all the things wey dey happen, for cervix, wey be the neck of the womb, that's where the cancer of the cervix stays, or that's where it starts from. They will quickly detect it in the early stage and do something about it. So it's not when they don't pass menopause finish, they go come see blood, they will come dey wonder, say, where is this one coming from? If they've been screening themselves regularly even before they reach menopause, it's always better.
Okay. Okay.
Yeah, so menopause, so you can see the different phases: perimenopause, menopause, and postmenopause. They are different.
We don't understand am now. So the next question wey I bin wan ask, but e be like say you don answer am halfway. I wan ask you, say, early menopause, women suppose fear am? Is there is it a cause for concern when person begin see menopause, when biologically no be the time when e suppose see menopause, make women begin run go hospital when they begin notice that kind thing?
And the thing be same, people are different, and the mama wey born everybody no be the same mama wey born everybody.
Na
So
true
everybody
talk.
dey different for different way. So for people, some people go achieve menopause earlier than other people.
Okay.
And sometimes it is normal. So some people have early menopause. So for people that start saying all those things before the age of 45, we say that the menopause is early.
Okay.
For the people wey say it's 45 to 55, that is normal.
Okay.
Okay. And then we now have some people that even before they reach age 40, e be like say menopause don come o. E be like say they no dey see their period again. Those ones, they need to check them for hormonal problems. They need to check them for thyroid problems. They need to check them for what we call premature ovarian insufficiency. Na big grammar, which
No
just
be
means
small
say,
thing. As you
which
dey talk
just
am
means
now, I
say,
just dey imagine am for my head.
the thing
Abeg
just
help us
means
break these things down small
the
small.
thing just means say the ovaries wey be the egg of the woman, e don shut down. Dey do the work wey e suppose do, and e don shut down too early, more than expected. So that is what happens in that one. So that's for people that see that below the age of 40. But as from age 45, is considered normal. It's considered normal to start entering menopause and start seeing all those changes. And the changes that come with menopause, is important we talk about it, so that people go know say no be disease.
Exactly.
Go
Na
dey.
in fact we dey come because that change na im carry this topic come na, because I don hear plenty complain. People don dey fear, a lot of them wey don reach the age of menopause, wey don dey experience these things, they don dey fear. Some sef no even know wetin e mean. They no even know wetin, so they are not even prepared to welcome it. They no know say nature, no matter how you run, you go still catch
Nature.
up with you. So that's why we are talking about this topic. So this is Awareness Diaries on Top Joyful Talks TV. If you just dey join us, you don miss small thing, but you go fit catch up with Dr. Adeogo. We dey here, we dey talk about menopause, the myth, the fact, everything that has to do with menopause, things wey you no know, things wey you never hear before, how you go take manage am, everything that you need to know about menopause, na wetin we dey talk today on Top Wellness Diary. If you never subscribe to my channel, kindly subscribe to Joyful Talks TV. Write, put out your comment. If you get experience, maybe e get as e dey do you, no understand, put the question there, make Dr. Adeogo answer you. You know say to go hospital now, consultation no be small money o. But on Top Wellness Diaries, consultation is free. Nobody go collect money from, na only you go open your mouth talk wetin dey do you. So now, doctor, make we no waste plenty time. We wan enter deep into the matter, as we don talk about menopause and the age wey women suppose experience am. Now make we go into other segments. What are the common symptoms women dey experience when they reach that age? You don explain the perimenopause, you don explain the menopause itself, you don explain postmenopause. So wetin be the changes as woman wey dey enter this different phases? What are the changes in their body? Hormonal imbalance, mood swing, plenty things. Abeg, I no be doctor. Oya, make you talk and explain
So
to my people.
all the things wey dey happen to women when they reach that menopause, they go dey feel tired. They go dey feel say their sleep no be like before. They no dey sleep well. They go just dey toss around in bed. They will just make sure that they will just notice that once they lie down, sleep no go come on time, or if they sleep, any small question they don wake up, they no go fit sleep back. All those one fit happen to them. Then they go fit dey sweat a lot, what we call hot flashes. They fit be inside AC and e go be like say they pour water for their head.
In fact, doctor, wait, these hot flashes, somebody dey explain am hot flashes, e come be like say they dey exaggerate am too much. Abeg, explain am to us. I know say you no be woman, but as e be say you be doctor, you go fit explain to us, because as the way they talk about hot flashes, even if you are inside AC, you go still dey sweat. I say, how this thing be sef?
We
I
don see
wan
am
experience
before.
am. Tell us
We don
how these hot flashes dey be.
we don see am for patients. You go just say the person go just dey sweat. E go be like say they pour water for the person head. The person go dey with towel all the time. You go see the person clothes don drench, because any small thing na so sweat. So this hot flashes, and they come periodically. You go just say the person wey dey look normal now, suddenly e go just dey covered with sweat.
Even for inside this
Mm.
cold season.
Anywhere e fit happen anywhere. Even for night you go see say the person dey sweat, the person bed sheet, pillowcase, everything go don soak with sweat.
Ah,
E fit happen like that. It's part of the symptoms that we see in
women dey see
menopause.
something.
Then for some women, they will also notice that they have sex drive reduces, the libido to have sex don drop because of the hormonal changes. Hormones like estrogen, they don dey fall down, in the woman's blood. So all those hormones that are involved with her reproductive cycle, all of them don dey reduce. So you go see say that kind woman, she no go dey look forward to sex, she go have vaginal dryness. Sometimes you go find out that women like this, they go dey have bone pain all the time because their bones are not strong like e used to be before. There's
See.
something we call bone density. Now, one kind of scan we dey use check that bone density, we dey call am DEXA scan. E go let the density, or e go check the density of the bone of the woman. But as menopause don come, the density no be like before. If the woman fall kpakam, the bone go break. If
Ah, na
she
im make dem dey advise women say if they don dey age make dem no make mistake to fall o,
because
because
they
if
are
you fall na wahala be that.
their bones are liable to break, to have fractures. Make she no dey fight with somebody because one gba like this, bone don cut. So all those kind things then dey happen. Then you go now see say this kind woman again, sometimes she may have issues with her emotions because something is
Because
happening
na im be,
inside
in
her.
fact e just waka enter inside the next question wey I wan ask you. I bin wan ask say how all these things wey you dey talk about now, you sure say e no go affect emotion, and e no
E go
go
affect them.
bring mental, um mental torture or
Psychological
something
effect.
like that, e no go fit affect them mentally.
Yeah, e go fit o, e go fit. E go fit affect. So you go see say those kind people, you go see that they will have issues with sleeping. They will have issues with their emotions. They get irritated easily, they get
Easily.
angry easily because they are somewhere, they are wondering why they are the ones that are only sweating. They are wondering why they are having bone pain all the time. They are wondering why they can't sleep well. Say even me sef, wey no be woman, wey no enter menopause, if I no sleep well the next morning,
E be
everybody go
like
dey hear
say
am.
your, yes, e go affect you
Everybody,
sef.
e go affect you because any small thing go dey irritate you, any small,
Yeah.
because the way you dey feel for inside you, you no feel okay. All those things dey affect a lot of people. So we go see say those kind of women, they go dey have emotional issues. You go see say wetin we dey call irritability go set in.
Okay.
Irritability go mean say the woman, any small thing go make
Go
her
irritate
angry.
am. Yes.
And then she go dey easily triggered. So this kind of woman, her patience too go don reduce. The thing wey she dey tolerate before, she may no fit dey tolerate them again. So but people wey dey around her, if they no come have that understanding say wetin dey do this woman no be her, na the phase wey she dey go through. Even people wey dey work with her for office, if they no understand say this woman, wetin dey do am no be say she don suddenly turn witch, na because of wetin dey do her. So it's good. So the support she needs includes family support, social support, and support from everybody around her, so that she will
She
be
go
able to
feel
go through
alright.
that
That
transition
phase.
easily. Yes, and some women come dey enter depression too. We dey see say
So
depression dey enter
menopause
for some.
fit drive person enter inside depression.
Yes, yes. If it send some people into depression, oh, yes. If it sends some people into depression. So you find out that some people, they feel depressed, they cannot do all the things they can do before, they are always sad, they are always crying, or they always say, I don't even understand what is wrong with me. I don't know what is going on. My body have changed since. And you just notice that the person is just tired of everything. And there's no explanation for it. And if you now see people who are around her that are judgmental, people that are not patient because of ignorance, they can worsen the situation for the woman. Because everybody around her will just be complaining that she has changed, that why is she behaving like this? But they don't want to understand that she's undergoing a stress. It's a stressful transition for some people. And this menopause, for some people, it dey mild for some people. You
So
dey
in fact,
do.
e good say we dey talk about this topic because information is key. If plenty women no know say this kind phase dey, and I sure say a lot of women don dey hear menopause, but they just dey wait until the time and the age reach, they go enter inside the menopause, but they no know say there are some informations wey you suppose get. Put am for your hand like this, hold am, dey wait. Somebody like me now, I don dey wait for the menopause, and because I don hear plenty things about am, so I'm waiting for it. I am prepared. I dey tell am, menopause come, I dey wait for you. You understand? So na im make us dey have this conversation, so that a lot of women will be prepared. No be say the thing go just hit them boah, and they go begin, some of them sef no even know wetin dey do them, like this hot flashes. They get too, heat. Even when everybody dey feel cold, only them dey feel heat. They no understand. Na recently women begin understand wetin be mood swings, wetin be hot flashes, why some hormonal changes dey happen for their body. Before now, they no understand, and even a lot of women no still understand because they no get the right information. So na im make us dey talk about this topic today. So if you are just watching, you are just joining us, this is Wellness Diary on Top Joyful Talks TV. Thank you for coming in, and you never miss plenty things because we see the talk. Dr. Adeogun dey here with me. We dey deal with menopause, the myths, the fact, and everything you need to know about menopause. So now, doctor, make we waka enter into other questions. I hear say you talk about vaginal dryness when you dey explain some kind things for us. In my head, I dey think am, vaginal dryness, wetin be the remedy? How woman wey get vaginal dryness, wetin e go do? Abi once this menopause set in, pari, no more sex, e don e don close chapter be that one? Abi wetin person fit do, woman fit do, to correct or to help herself for this vaginal dryness?
You know that I mentioned that this menopause for some people e dey mild, e no dey too severe. But for some other people, e dey very, very severe, say they need help. So if it is a very, very severe situation, you go to the hospital. The gynecologist will recommend some creams for you. We have some lubricants, we have some estrogen gels, they are hormonal based gels, and then you can apply. It helps to improve the symptoms of vaginal dryness. So sometimes they come in form of gels, in form of rings, in form of lubricants, and those things, once you apply them, you notice that sex is more tolerable and the dryness is eliminated. So it has helped a lot of women. But these are things that we should let our people know, that you don't prescribe these things for yourself.
Because say for this part of the world, we go for self-medication. If
Ehen.
Mrs. Labaja use am, Mrs. Obi go say, that thing wey Mrs. Labaja use, make her go use am. You no know say your own body dey different. So e
Your
good
own
as you
body
dey
dey
talk am
different.
now.
So it's very important that once you start noticing these changes, you go to your doctor, you see a gynecologist. That's the doctor wey dey treat women matter. So the gynecologist go don know your history, go don know all the illness wey dey do you before, go don know all the drug wey you dey take, and can make the best decision on the choice of what will work for you. Because some people, when they have these menopausal symptoms and it's so serious, we dey give them wetin we dey call hormonal replacements.
Now wait,
Because we
now
don
wait, now I wan ask that question. I don dey hear am since. Hormonal therapy, abi wetin una call am?
hormonal replacement therapy,
Therapy.
HRT, yes.
How effective that thing be? If you
E
work?
dey effective, e dey very effective, because for some people you dey give them only estrogen, for some people you dey give them estrogen and progesterone. But the thing be say e no apply to everybody, because if the woman gets history of breast cancer in her family, make she no near hormone replacement
Doctor, you
therapy.
don carry another one waka come now. So if woman
So
get history of cancer, not only
in
breast
their
cancer, be
family,
with cervical cancer too.
breast cancer in particular, if the woman get breast cancer, maybe the mama get breast cancer, be the sister, be the auntie, be the grandmother don get breast cancer, e don dey for their genes, their family line, make e no near hormonal replacement therapy. Because as e just collect that hormone, e go just wake up cancer wey e don get risk for am
Hey,
already.
oh
So
my
it's there. So
goodness.
that's why you see say we don talk before, say these things you don't go and take it by yourself, you need a doctor to guide you. You need a doctor that will know your history well, that will tell you this is the way to go. Because sometimes if you are looking for solution without a doctor, you run into more problem.
More problems like
Yeah.
somebody go get malaria now, you go put all those concoction, they say na agbo, they no know the dosage, they no know anything, they go just dey drink. Tomorrow we go hear say one kidney don
Kidney
pack
and
go one
liver
side.
don't pack up. Exactly.
So e no good, all those self medication e no good. You dey hear am now, doctor don talk am, no be me talk o, na doctor dey talk. He say all those self medication e no good. So doctor, make we waka again go other question wey we get. Wetin be the remedy? You don talk about this hormonal replacement now, therapy now, say no be everybody e good for. So wetin be the natural remedy wey person fit use take tackle this menopause, take wait for am as e dey come like this, as age dey come, you carry wetin dem dey call am, natural remedy, take wait for the menopause. Wetin be the natural remedies wey fit help some women?
You know say they talk am say no be when problem come we go start dey look for solution. You go
But
don
for
dey
this part
start.
of the world na, when problem don dey face you face to face, na im we dey find solution o.
No, because that problem fit come in a way that you no go fit get yourself balanced at all.
Na true
So
talk be
so
that.
we have to start preparing our body for what we know is going to come. So what are the ways we can do it? Simple things: balanced diet, eat correct food.
Exactly, lifestyle join abi.
Lifestyle join, I dey come there. So part of lifestyle, your diet dey there, your exercise dey there. You want your bone to be strong to old age. No be when menopause come you go come dey do exercise wey you suppose don dey do since. So your diet, you cut out all the foods that are not healthy because you know you are getting older. So you have to be intentional about your
About your
choices of
food.
food. That only the food that will nourish your body is what you are going to be eating. It is not just because it tastes sweet. It is not just because everybody is eating it. It is because of the value it is going to bring to your body. So diet is important, exercise is important, and it is also necessary that you do exercise that will help your bone. We dey call them weight bearing exercises wey go increase the density, improve the density of your bone so that your bone no go dey break like biscuits. Very important. Then it's also important that you sleep well. A lot of people no dey sleep well. Quality sleep is
I no
important.
blame them, dey hustle too much o, doctor.
But when we make all the money finish and the health don go away, we go now dey use the money find the health wey don lost.
Na im be the thing so.
So we have to balance it. So sleep is good because as you dey sleep, e go balance everything wey dey your body, including your hormone, including your immune system. Everything go dey the way e suppose be. So no be when you reach menopause you go come dey look for solution for sleep. Make you start now. Dey sleep well.
And you know say when people begin take pills for sleep, they go come dey addicted to the pills. Say if they no see
No
the pill, they no go sleep.
no be only addiction. If na only addiction e go good. They go get addiction, then they go build tolerance to the pill. So if they start with 1 milligram, 1 milligram no go do them again. They go to 3 milligram. Very soon 3 milligram no go do them again.
So
They
na
go
so e
dey
go dey
increase.
increase.
Yes,
That
until they
one na
now go and
serious
take
matter o.
overdose. So it's very important that sleep. If you're having sleep issues, go to your doctor. A lot of people they say, "Shebi na sleep, shebi I just know they sleep and na so I dey be." It's not a good thing, no. If you no sleep well, na big problem wey you suppose find solution to on time. Then it's also necessary that stress management too, because that menopause, as we talk, you know, say it sound like stress. All these things wey we dey talk, so you don't want to add external stress to the stress wey dey happen inside your body.
Exactly, because that one
So
na another wahala.
so you want to make sure that you limit your stress levels and you are relaxing well and you have good environment. And stress now that we're talking about, not be only stress from outside, even stress from people. Anything where they stress you, you take it out so that your mind go dey calm as you dey go through this transition. Then it's important that you get support from family and friends and workers and even your workplace.
I been
People
wan
don't
ask that
understand.
question that time when you dey talk about sex. I been wan ask the question, say how husband now or partners fit take help their wife, because some of them they go just go outside, they say my wife no dey do as e dey do before. They go just, they no know say the woman dey go through a lot. So help, as you talk about help now, how they fit take help this woman when they go through a lot, when some of them sef no even know. And another question wey I wan add to this one, so that we go quick finish everything we need to do about menopause today. Menopause dey affect body size, because I dey hear say if you slim before, once you enter menopause your size go begin big. I no know whether na true abi na false. Doctor, abeg make you help us answer the question.
But the thing wey dey there be say, this support, this emotional and psychological support wey we dey talk about, the spouse, whether the partner be the husband, also suppose dey support the
The
woman
wife,
to
yeah.
understand that is what is happening at this time, and the woman is going through a lot, and they don't want to add more to the stress. So they will be understanding, they will be caring, and they will be present to support her in every way possible. Even the children too, when they see say their mama go just shout because small water pour for ground, or their mama the way she go react just because they off light when they no suppose off light, make dem no think say their mama don turn witch. Na menopause fit do
So
that too.
children, make you dey hear if your mama shout say you pour water, know say
No be
na
say your mama
something dey do
hate
am.
you,
No be
no
say
be
e
say
hate
she.
you, something dey do am. She dey deal with a whole lot of things inside her body. Doctor, continue.
Exactly, exactly. So for weight, the size of somebody, is dependent on many things. Though we agree that some people may start gaining weight a bit, but weight has a lot to do with genetics, the people wey born you and your family. So that is a more stronger factor to determine that somebody's weight than saying it's menopause itself that is bringing the weight. Some people they have this middle age spread. It's around that middle age that then they add the little flesh, but it doesn't necessarily mean that now the menopause itself where they bring them. Some people already have the genes in them to be big,
Big.
because the people wey born them, all their sisters, all their brothers, they all dey on the big side. So no be say na menopause itself dey bring am, because many women, slim women too, that are very lepa women, so then they enter menopause and they no dey add weight. So menopause itself can make some people add weight depending on the genetics they have or that they carry before.
Okay, thank you so much, Dr. Adiogo. We never leave you. You still there with us. So if you are just joining us, this is Wellness Diaries on Top Joyful Talks TV. You can hit the notification button, so that when things like this they come next week, you go, get the notification and you join us. Subscribe and share. If you know say one woman suppose hear this message, abeg share the link, make the woman understand, because some of them no know wetin dey do them. They think say na one winch for village na im don dey pursue them come Lagos or come any city wey they dey. They no know say na their body dey change as woman dey. You know say man and woman life no be the same thing. Woman get wetin dem dey call biological clock. I know say man get im own, but im own no be biology, im own na money. Na money na im that clock dey tick. Say 30, 40, 50 never make money na wetin e dey tick be that. But woman, im own na biological clock. You dey tell am say at 24 you suppose don dey born pikin at 30 you suppose don finish at 20, 25 you suppose don marry na im be our own clock. So na im make me dey talk about menopause today. So now, doctor, e get wetin I don hear, plenty things wey I don hear about the fact and myth of menopause, plenty things. I no know whether na true, so make you help us clarify whether na true or false. I don hear say person wey dey perimenopause e fit get belle. I no know, please help me clarify that one.
Yes, person wey dey perimenopause fit get belle because she still dey see her period, everything still dey happen as e should be before. Because e no dey regular like before, the month that the thing is regular and she's ovulating, if she meet with her husband, she fit get belle. So somebody who is perimenopausal fit still get belle, is very possible. But another thing about belle be say there's something we call ovarian reserve, meaning how many eggs you get. As a woman dey grow older, the number of eggs wey she get dey reduce. So there's one test we call AMH,
How
na
many how
blood
many
test.
how many woman suppose get?
Woman get ovaries, get two ovaries. So the
Okay.
ovaries, then they produce, then they
This
release
egg.
egg every month during
Okay.
ovulation. So wetin dey happen be say this AMH test wey we dey talk about, na blood test, is a
Okay.
measure of a woman's ovarian reserve. If the AMH dey, if the level dey okay, we go say the woman gets enough eggs. The chances of her conceiving is high. But
Hi.
we don dey notice say as women don dey grow older, as dem dey reach that 40 upwards, the
The egg go
AMH
dey
don dey
reduce.
reduce. E don dey reduce.
You see
So by
that
the time
biological
the
clock wey I dey talk?
yes, so as the AMH don dey reduce, no be say she cannot get belle o, but the probability don dey go down. The percentage of her achieving pregnancy don dey reduce. So it's very important for us to know say perimenopause, menopause never happen. So anything can still happen. She can still get pregnant if she has a regular cycle at a particular period and she meets with her husband at that time, she
She
can
can
still have
get
children.
belle.
But we should also mention here say something very important. Every belle wey a woman get after age 35,
um
there's a risk of the baby having some conditions wey we no want.
um which kind
So
condition? Na
when you
im dey
dey
bring
hear
in gbese? Dat
when you hear Down syndrome, all those things like Down syndrome, you go see say research has told us, has shown with evidence that the older the age of the mother when she get that belle, the higher the risk of that Down syndrome.
So
So
between what age to what age woman suppose dey to have normal babies?
a woman by the time a woman is in her adolescent age and like 18, 19 up to her 20s, fertility is very good. Even some people into 30s, fertility is still good, but we encourage you so that you won't have any risk of any problem with the baby, because the baby wey you wan bring into this world, you no want baby wey go give you problem, and you no want baby wey no go fit go school, or you no want baby wey no go walk when e suppose walk, or crawl when e suppose crawl, or talk
Dat
when e
one na
suppose
big
talk.
wahala, dat
um
one na big one, na stress on its own.
So we dey call those kind children children with special needs.
Needs.
So they cannot go to normal school, is a lot of problems. So all those things also come from planning, because the older a woman gets, the higher the risk of developing this kind of conditions.
Doctor, if you no come marry on time, wetin we go come do now? Like some women wey no see husband on time, wetin dem wan do?
But the thing be say no be everybody, that is why in medicine, in our healthcare, we know dey say everything, nothing is 100%. So we no go say because somebody born for age 37 say the child go get Down syndrome. Some people dey born for age 39, the child go dey normal, but we are just saying that the risk is higher.
Hi.
Yes, if you
I
start
trust
having
Nigerian
children
women, they go carry am go God altar, they go pray for that one. Prayer go solve that one. So make we go the next one. I don hear people say once you enter menopause you don old, you no know wetin life dey talk about again. Abeg, na true?
no be true o. Age is of the mind o. I go see somebody wey dey 80, on their 80th birthday, dem dey wear high heel, dem dey do hair, dem dey make up, dem dey do fine, they
Na
don
so
pass
e suppose
menopause.
be. Na
they
so e
don they
suppose
don
be.
pass they don pass menopause 20 something years ago, and they are doing fantastically well.
Na so.
So whether you wan old abi you no wan old, that one dey your mind. And whether you dey old or not, everything wey you dey eat, you are telling your body how you want it to be old. If you dey eat nonsense, your body go show you nonsense. If you dey
Abi.
eat well, your body go treat you well. If you dey sleep well, when you are supposed to rest, you are giving your body the rest, the body go treat you well. But you know say you don
True
tire,
talk.
you still dey push yourself. You dey do 10 jobs, you no get holiday, you no go leave, you no go anything, you no get break, na only you dey work like machine.
Hello, Dr. Adiogun. Network.
It's impossible to look young.
All right. So,
Ehen.
all right. Continue.
Is it possible to look young when you are not treating your body right? You
Right.
have to treat your body right
So
to
I dey
get
always
the
dey
right.
tell people say body be like cloth. If you dey wear one cloth every day, dey wash am, dey wash am, dey wash am, na so e go dey fade, e dey fade. One day you go wash am, squeeze am, the cloth go tear kpaka. Na so our body be. So it's to be taking care of your body. Eat wetin your body need, no be everything wey sweet good for your body. Okay, doctor, make we go again before we wrap up. I don also hear say menopause, if you start menstruation on time, for children wey dey start their menses on time, maybe at age of 9, 10, say their when they wan enter menopause e go come dey early. Na true be that abi na false?
No be true, because menopause and the age of menarche wey you start your menopause, e no dey.
Mm. Continue.
So the age of you starting your menopause, I mean,
We don dey get little glitch here and there. Hello, Dr. Adeogun, can you hear me? Hello? Hello, doctor, can you hear me? Hello, can you hear me? Can you hear me?